I'm Dennis Hore. I'm a professor in the departments of chemistry and computer science at the University of Victoria.
I'm Bruce Wallace. I'm a professor in the School of Social Work at University of Victoria and a scientist with the Canadian Institute for Substance Use Research. Yeah, so Substance Drug Checking Project is a University of Victoria project that Dennis and I were able to get started and still keep going now over the years. And it started as a response to the toxic drug overdose crisis in British Columbia. What it is that we, as faculty and as a university-based project, are providing an essential public health service, basically. We're in community every day, being able to provide a drug checking, which is looking at the chemical composition of people's substances and being able to tell people if it is what they might expect it to be, because it's an unregulated market. And it's all meant to basically reduce the harms of illicit substance use.
And through this work, this is also an opportunity for us to develop and test a lot of new technologies. There are a lot of techniques out there which can do chemical analysis in a lab, but once you leave a laboratory-based setting, there's a lot of gaps in terms of what kind of technologies would work in a point-of-care setting.
I really hope that that our project can be looked at as to show what the role of university can be in responding to what people might call a societal problem. I think we don't have to be limited to researching problems as academics. I think we have a role as universities and as academics to be able to provide some of the responses to those problems. And then what our drug checking projects tries to do is we try to create something that hasn't existed, that's not there, and then attach our research to that, to be able to research how do you create these interventions that might be really useful to respond to the public health needs, and then to put evaluation to that, and then to build new innovations.
Yeah, I think one of the things we think about as far as the future steps is seeing what we can do to enable other people to work in this area as well. So far, a lot of the innovations we've developed for our software, whether it's the service delivery models or the hardware we use or the software, have all been kind of geared towards us. We've been so focused on what are the best tools that we can develop to offer our service and our research. And now we're thinking about how can we put these tools in the hands of other people and make them more flexible and scalable so that other people can use them even outside of our city and outside of our province. And
I think one of the things that we learned was the chemistry students were all of a sudden learning a lot of social work, and a lot of the social work students were learning a lot of chemistry. And that I didn't expect that, and I think it was we were able to start seeing the co-learning that happens in our settings, but also just how they're not that separate disciplines maybe when you're starting to work together on solving some of the problems that are in front of you.
in this case of our particular project, we just want to acknowledge that it's a large group of people who are doing the work, that are doing the research, that are doing the work in the community, that are operating the service in the storefront, that are interacting with communities across BC that we provide services and engage in research with. So we want to acknowledge the dedication and hard work and all the inspiration we get from all those people.